This presentation will review the Sacrum and Coccyx image analysis. For the AP axial sacrum, image analysis guidelines state that the ischial spine should be demonstrated equally and should be aligned with the pelvic brim. The median sacral crest and coccyx should be demonstrated in the alignment with the pubic symphysis. The first through fifth sacral segments are seen without foreshortening. The sacral foramina are demonstrated with equal spacing. The symphysis pubis is not superimposed over any portion of the sacrum. The fifth lumbar vertebra, the first through fifth sacral segments, the first coccygeal vertebra, the pubic symphysis, and SI joints should all be included within the exposure field. I have provided for you the image analysis guidelines for your review. So let's talk about rotation because it is an infamous misposition that we all tend to do with our patients. In an AP axial projection, there are certain characteristics that help us determine whether there is rotation in this sacrum projection. In an AP projection, the sacrum will shift towards the side positioned further away from the IR. As you can see, the sacrum is towards the right side of the patient. The pelvic brim and symphysis pubis shift towards the side position closer to the IR. So when looking at this image, we can determine that the right side is up and the left side is down, making this an LPO position. If the patient is rotated in that LPO position, the left ischial spine is demonstrated without pelvic brim superimposition, and the median sacral crest and coccyx are not aligned with the pubic symphysis, but are rotated towards the right side. So as you look at this image here, you can determine that we are in an LPO position with the right side furthest away from the imaging receptor. In this projection, we have just the opposite. The patient is rotated in an RPO projection. In this case, if the patient is rotated in an RPO projection, the opposite is true. The right ischial spine is demonstrated without pelvic brim superimposition, and the median sacral crest and coccyx are rotated towards the left side. Now, this isn't an extreme demonstration of rotation. However, if you take a look, your pubic symphysis should be about here, and your sacrum and coccyx are not, it's terrible drawing, not in line. This means that the left side of the patient is furthest away from the IR and the right side is down. So we are in an RPO projection. Let's talk about central angulation and its relationship to the sacral foreshortening. We know that to demonstrate the sacrum without foreshortening, your central ray needs to be aligned perpendicular to its the long axis of the sacrum. In most cases in most patients, this requires a 15-degree cephalic central ray angulation. If that AP axial sacral projection is taken with insufficient central ray angulation, the first, second, and third sacral segments will be demonstrated as foreshortened. In a case that there's excessive angulation, the sacrum will be elongated, as in this case, and the pubic symphysis will superimpose over the inferior segments of the sacrum. As you can see, the fifth sacral segment is superimposed by the pubic symphysis. So we need to decrease that angulation. So let's take a look at this practice analysis. The first thing I look at is, do I have all my anatomy on the projection? It's a little bit questionable here. Yes, the sacrum is on here. However, is it adequately positioned? No. So if we first glance, we can see there's some degree of rotation because the sacrum and the pubic symphysis, that was terrible, I'm sorry. The pubic symphysis are not aligned appropriately. You can see the pubic symphysis is over, the sacrum shifted to the left. So in my mind, there's rotation. The right side is closest to the IR because the pelvic brim and the pubic symphysis shifted to the side that was down. Additionally, your sacrum shifted to the side that was up. So this tells me we're in that RPO rotation. The second, I guess for a lack of a better term, eyesore here is we don't see the sacrum demonstrated in its entirety. Actually, it is superimposed down here by the pubic symphysis. So this should tell you that there is an angulation issue as well. So we are not appropriately angled. We're actually excessively angled. So we need to decrease the degree of cephalic angulation and also rotate that patient so that towards the left side so that the mid-coronal plane is parallel with the IR, and repeat the projection. So now, next, let's talk about the image analysis guidelines for the AP axial coccyx projection. In an AP axial coccyx projection, image analysis guidelines state that the coccyx should be aligned with the pubic symphysis and is at equal distances from the lateral walls of the inlet pelvis. The first through third coccygeal vertebra are seen without foreshortening and without pubic symphysis superimposition. The coccyx is at the center of the exposure field. The fifth sacral segment, 3 coccygeal vertebrae, pubic symphysis, and pelvic brim are included within the collimated field. These are the image evaluation guidelines that we just reviewed. When talking about rotation and determination for coccyx, the same guidelines for the sacrum apply to the coccyx. Again, your pelvic brim and pubic symphysis rotates to the side closest to the IR, and the anatomy, which is the coccyx, will rotate towards the side furthest away. So in this projection, you can see that the coccyx is closer to the left side rather than the right here. And this tells me that the right side is down and the left side is up. And this position that the patient is in an RPO projection. This image, again, the coccyx is misaligned with the pubic symphysis. It is, in this time, closer to the right side, indicating that the right side is the side that's furthest away from the IR, and the left side is the side down. And the patient is in an LPO projection. We need to shift the patient so that their mid-coronal plane is parallel with the IR. So let's take a look at this AP axial practice analysis for the coccyx. First question I ask myself, is it all my anatomy present? Well, for an AP axial coccyx, we should demonstrate the first through third coccygeal vertebra. And I only see 2 here. There may be one more below. So that kind of indicates to me, do I have enough angulation to adequately demonstrate the coccyx? I think we might not have enough angulation. So first, we are going to have to readjust our central ray and increase the degree of caudal central ray so that we can get that coccyx where it needs to be in our projection. A second issue I have with this projection is that the sacrum and coccyx is not in line with the pelvic brim here. It's actually closer to the left side of the patient, which indicates to me that the right side is closest to the IR and the left side is further away. That means the patient is in an RPO position. We need to rotate that patient's left side until the mid-coronal plane is parallel with the IR to ensure that we obtain an appropriate projection. Please watch part 2 of this image analysis for the lateral sacrum and coccyx.